Hi, everyone. My name is Rachelle Finck, and I currently serve as the Director of Behavioral Health and Student Services with Taylor ISD. And myself, along with Miss Lindsay, are the action group leaders for the Mental Health and Wellbeing Action Group. You can find all of the things we're going to talk about today and more about the Community Health Improvement Plan, also known as the CHIP, on the healthywilliamsoncounty.org website. Here you will find loads of information, including top health priorities and action plans for all of the action groups that we currently are leading. Today, we're going to focus on this lovely one right here, the Mental Health and Wellbeing Action Group. And we're going to talk about the key things that we will be focused on in our work together this year. We will meet 3 to 4 times this year. Our first meeting will be on February 2nd, starting at 1:30 in the afternoon. And you can find all that information on this as well, and by signing up for the mental health or the Healthy Williamson County mailing list, where all of that information will be communicated. Today, we're going to dive into what's called the CHIP and focus on the action group priorities for this year. So you're going to notice that there's a lot of work that's going to happen in this group itself, and it's really broken up into 3 main pieces. The Mental Health and Wellbeing Action Group, which is the group that we're going to talk about today. The Behavioral Health Task Force, which is a separate group, however, very highly engaged and focused with the work that we're going to do here, and the Youth Mental Health and Wellbeing Task Force as well. Again, a separate group that meets in a different time, but is also very highly involved and integral into the work we're going to do. And we're going to go through all of those pieces today. Our overall focus for this action group is to build resiliency by improving mental health for children and youth and mitigating the impact of the COVID-19 pandemic in Williamson County. So our first goal is really going to be to make sure that Williamson County residents have access to high quality, equitable, affordable, and timely mental health care. Our objective is that by 2025, we will increase enrollment and usage of the Texas Child Health Access through telemedicine, also known as TCHAT, in all 13 Williamson County school districts. Currently, 7 out of 13 school districts in Williamson County are not fully on board at the time that this was written. We will integrate behavioral health into primary healthcare systems and schools for individuals and families. And action steps include promoting the use of effective educational resources to improve public understanding of mental and substance abuse substance use disorders and when to seek treatment. Increase awareness of effective 365 24/7 crisis services and systems to community partners. Support partners by promoting events, trainings, educational resources, curriculum, and services, and increase awareness of the Texas Child Mental Health Care Consortium and their services. So all of these things will come together to really make sure that we have high quality resources and systems of support to support our students in Williamson County. The second objective is that by 2025, we will reduce the substantiated child abuse rate in Williamson County from 4.7 cases per 1,000 children to 2 cases per 1,000 children. And we will work through to increase safeguards and education to empower families and communities to prevent and respond to neglect, abuse, and violence while supporting those who have experienced trauma or violence. Our action steps include connecting families directing to parenting education and other community resources, engage pediatric providers to screen patients for adverse child experiences, also known as ACEs, and provide resources to their parents, and to promote mental health first aid training for schools, communities, and providers, which can be provided free of charge, and putting those in the hands of those that need to schedule that training. On page 11 of our CHIP, we are going to work through and talk about the Behavioral Health Task Force Action Plan. The Behavioral Health Task Force of Williamson County focuses on countywide mental health policy and systems change for all age groups. And so this one is very heavily focused in the system of access to mental health and behavioral health care for everybody in our community, not just for children, not just for school-aged youth, but for really anybody in Williamson County who needs access to mental health support. So the first goal for this Behavioral Health Task Force is that Williamson County will advocate with representatives in the Texas legislature to increase and sustain funding for behavioral health services that support a robust continuum of care. Our objective is that Williamson County will work with the Texas legislature to increase and sustain local funding opportunities available through public and private partnerships. And strategies include that the Behavioral Health Task Force Subcommittee will commit to continue to work with the Conference of Urban Counties, Texas Council for Community Centers, Texas Sheriff's Association, and Bluebonnet Trails Community Services to discuss identified gaps and develop an action plan. So this is one subcommittee within the overall task force. Another subcommittee will provide legislative recommendations through developing talking points and preparing subsidized or standardized materials, and will present to the Behavioral Health Task Force during quarterly meetings. And the third subcommittee will organize for Behavioral Health Task Force to host legislatures to discuss the future of behavioral health care in Williamson County, with the possibility of discussion at the local match to address identified gaps. Invite individuals with lived experiences to share their stories with legislators, because we know that those shared experiences are so important to understanding the need for comprehensive behavioral health care in Williamson County. Action steps for this entire goal include identifying session priorities, monitor legislation, both written and proposed, notify or identify necessary responses, provide data and information to support and address changes needed. The second goal of this action group is through collaboration and partnership, Williamson County will begin a pilot project of a jail-based competency restoration program focused on reducing the number of days from arrest to disposition of the court case. So our objective is that by 2025, the average number of days for incarceration for individuals with severe mental illness will decrease from the established baseline after implementation of jail-based competency restoration programs in Williamson County. Strategies include a jail-based competency restoration committee will be formed to monitor success, identify any issues that may arise, and ensure communication among involved agencies and departments. Another strategy is that a baseline of a number of days of incarceration for individuals eligible for jail-based competency restoration program will be identified. And thirdly, Bluebonnet Trails Community Services and the Williamson County Sheriff's Department Corrections Division will expand the jail-based competency restoration program. Action steps include the start of a jail-based competency restoration program and creating a dashboard to track activity. Some background for this third goal. According to the CDC, suicide rates increased approximately 36% between 2000 and 2001, or 2021, my apologies. Suicide was responsible for 48,183 deaths in the US in 2021, which is about one death every 11 minutes. The number of people who think about or attempt suicide is even higher. In 2021, an estimated 12.3 million American adults seriously thought about suicide. 3.5 million planned a suicide attempt, and 1.7 attempted suicide, according to SAMHSA. Suicide affects the people of all ages. In 2021, suicide was among the top 9 leading causes of deaths for people ages 10 to 64. Suicide was the second leading cause of death for people ages 10 to 14 and 20 to 34. Williamson County's age-adjusted mortality rate due to suicide is 13.5 per 100,000 population, exceeds the Healthy People 2030 target of 12.8. So in response to that, our third Behavioral Health Task Force goal indicates that Williamson County will continue to work to reduce the stigma of seeking behavioral health care services by increasing public awareness that mental health care is an important part of the overall health care and wellness. Our objective is that by 2025, the Williamson County will create a data-informed suicide fatality review committee to gather appropriate data and identify community needs. Strategies include improving suicide-related data collection by receiving all reported cases from all 4 precincts within Williamson County. Suicide Fatality Committee will define a mission and scope of work within legally authorized ability to pursue the objectives 4.1 that we'll talk about in a second. And the Behavioral Health Task will host the first Suicide Fatality Committee review meeting after receiving ethical and legal concerns and reviewing approval from leadership. Action steps include identifying key professionals to inform a Suicide Fatality Committee, explore obtaining suicide data from all 4 precincts via juvenile probation services, and recruit key professionals and representatives from identified fields to join said committee. Our fourth objective of this task force is that by 2025, Williamson County will work with mental health providers, nonprofits, churches, schools, first responders, and the justice system to increase knowledge of risk factors of suicide and life-saving resources available. Strategy for this group includes establishing a subcommittee to increase knowledge of risk factors of suicide and life-saving resources available by forming a partnership with the American Foundation for Suicide Prevention. They will promote suicide prevention toolkits and curriculum for Williamson County to be made available on the healthywilliamsoncounty.org website, and develop a coordinated local public service announcement campaign for suicide awareness in September and mental health awareness months in May. Another strategy includes increasing efforts to train Williamson County residents on mental health first aid and suicide prevention training, including local businesses, schools, churches, and parents. We'll utilize media outlets to promote the accomplishments in the community. And finally, the last strategy for this goal includes explore creating the annual Behavioral Health Task Force Mental Health Conference. We'll identify and promote suicide prevention social media toolkits, conduct a public service announcement campaign, and many more. So that is all the work of the Behavioral Health Task Force. And finally, the Child and Mental Health Task Force Action Plan. So this one works in conjunction with a partnership with Step Up Texas. Step Up Texas is a project funded by the U.S. Department of Justice to bring trauma-informed and restorative practices training and implementation support to school districts, law enforcement, and the judicial system to reduce racial and ethnic disparities in engagement with juvenile justice systems. It is a partnership between the University of Texas at Austin, Williamson County Juvenile Justice System, and STARI. Initially funded in 2021, Step Up Texas began providing training in Williamson County while also convening a task force of community and organizational stakeholders to better understand local challenges and possible solutions. In 2022, Step Up Texas received additional funding to include implementation support alongside the training and to expand its reach to additional jurisdictions in Texas. With this funding, Williamson County Step Up Task Force participants defined specific areas of activity that could be addressed to mobilize the challenges and opportunities identified during work group sessions across the sequential intercept modeling process. These opportunities were narrowed down to a list of priorities for change. Once the full list of priorities was established, participants were given 3 votes with the goal of identifying 5 priorities for action planning. The top 5 priorities established through the voting process are listed below. Task force participants then identified key objectives and developed action plans for the top 5 priorities for change identified through the voting process described above. These top priorities were integrated into the 2023-2025 CHIP established below. So theme or goal 1 of the Child Youth Behavioral Health Task Force is to improve school-based diversion and disciplinary alternative action or education programs, also known as DAEPs. An objective for this goal is that by 2025, Williamson County will reduce school-based expulsions, removals, and referrals or arrests, especially related to zero tolerance policy. Baseline for juvenile justice alternative educational programs, or JJAEP, is that by 2022 through 2023 school year, a total of 104 expulsions and 169 total school-related arrests and referrals were conducted. So the strategy for this action group is to create a decision-making tree between police departments and school districts that allows for a situational response rather than zero tolerance policies. Action steps means we need to have education on the Texas Education Code, perform annual reviews, and provide transparent collaboration between school districts for awareness and sharing of best practices. Strategy 1.2 of the Child and Behavioral Health Task Force is to educate students regarding consequences for legal and life choices. We will promote resources for K-12 curriculum and substance abuse, law enforcement interaction, and potential consequences. Promote public service announcements depicting making school threats, gun violence, vaping, and etc., and promote or provide effective communication to community and school staff regarding decisions. A third strategy of this action subcommittee is to reform disciplinary alternative education programming by using and aligning trauma-informed relational and restorative practices in Williamson County. We will conduct tours of the JJAEP, conduct increased collaboration between DAEP campuses, and offer trauma-informed training for those in the district or in the community. Another goal of the Child Youth Behavioral Health Task Force is to eliminating school vaping in Williamson County schools. By 2025, we will reduce school vaping in Williamson County. Currently, we had 104 expulsions, 70% felony drug charges related to the use of THC vape pens on campus. Some of our strategies include form education and prevention subcommittee. We will create a county-wide team to establish K-12 preventative education programming for vaping and substance abuse use. Recruit students in campus administration, law enforcement, members, teachers, prosecutors, and judges. We will form an intervention and post-vention subcommittee. In this group, we will establish a peer support group by recruiting students, school counselors, community partners, and restorative practice practitioners. Provide restorative practices training for campus employees and students, and create a toolkit for resources for campuses to use for additional support. And this final strategy for this goal is to form an enhancement subcommittee. In this subcommittee, we will create a structure with options for alternative and graded consequences, provide training for campuses on a balanced disciplinary approach, and utilize juvenile probation, first offender program, law enforcement and school resource officers, campus administration, and chambers task force. A third goal of the Child Youth Behavioral Health Task Force is to increase community and student voice in shaping school supports, resources, sequential intercept mapping model with a focus on cultural responsiveness, reducing racial disparities, and the central role of the family in all solutions. Some objectives for this goal include, by 2025, we will form a committee representing community and student voices from each city in Williamson County. We will increase a community of trust for students and their families. Action steps include identifying key pillars of community, partners, students, and their families, intentionally focus on those not currently participating in the Williamson County Behavioral Health Task Force or Healthy Williamson County Coalition activities, hold listening sessions in those communities, create a survey for those not comfortable participating verbally and or publicly, determine which questions to ask in listening sessions and surveys, partner with appropriate organizations to survey entire communities, kindergartners, and higher education, creating a title and recognition program and structure for this large group and the community groups, partner with the Georgetown Project to build their youth council on youth summit concepts, and involve partners in leadership and decision-making process of the Healthy Williamson County Coalition activities and the Child and Youth Behavioral Health Task Force. A fourth goal of this action group is to improve behavioral health systems of support and discipline reform. By 2025, we will decrease the number of referrals to JJAEP that could have been handled by prevention programming. This strategy will expand focus on identifying and addressing root causes related to behavior linked to school discipline. Action steps include supporting school districts in revising code of conduct, discipline policies, and discipline practices based on the findings of the sequential intercept model mapping exercise, measure recidivism rates district-wide, measure the level of care accessed district-wide, measure the number of students going to JJAEP, measure the number of students needing hospitalization district-wide, and identify champions for change in leadership district-wide. A secondary goal of this group is to connect students with multi-tiered systems of support through a blend of school and community resources. We will identify champions for change, promote an automatic referral to mental health behavioral health services at the beginning and the end of disciplinary referrals for all all Williamson County schools. We will connect students with proactive universal prevention strategies or tier 1 supports and proactive activities, sometimes known as SPARKs, especially for those who lose access to those supports due to exclusionary discipline on their own campuses. Finally, we will provide school districts with a layered continuum of evidence-based practices that ensure that every student receives equitable academic and behavioral support that is culturally responsive, matched to the need, and developmentally appropriate. The fifth and final goal of this group is a lack of accessible residential treatment options outside of juvenile justice placement is a significant gap in the county. Behavioral health hospitals are not able to serve some of the youth in the greatest need. Some of these needs include homicidal ideation, physical aggression, intellectual disabilities, substance abuse, and youth who are, quote, too acute and require a high level of staffing. An objective for this goal is that by 2025, we will increase residential treatment placement options in Williamson County. A strategy for this goal is to use subcommittee to explore options for increasing, expanding, and creating hybrid funding stream options for more residential facilities and beds. Action steps include collecting multi-agency countywide data related to youth unable to admit behavioral health hospitals and residential treatment centers, explore partnerships with Medicaid, prioritize TRICARE, advocate for vulnerable populations, and explore privatization options. We will continue advocating for increased options with expanded accessibility and work downstream to identify the need for behavioral health interventions sooner, especially options for those vulnerable populations that are typically excluded from placement. We will collaborate with county commissioners, law enforcement, health and human services, Medicaid, comptrollers, legislation, churches, grassroots groups and coalitions and task forces, Bluebonnet Trails Community Services, funders, and foundations, and we will collect data from partner organizations. And finally, we will increase and improve training for assessment and placement staff. We will research models in other states, explore innovative ways to improve retention and recruitment of staff, and explore academic partnerships to develop a certification and/or career development pathway to encourage promotion and retention. So that was a lot of information. I want to take you back to the Healthy Williamson County website where you can find all of this information. Remember, you can go to healthywilliamsoncounty.org, and it looks like this when you first join the lovely group. And we are super excited to have you come join us on February 2nd, if you would like to come join the Mental Health and Wellbeing Task Force or Action Group. And we are looking forward to seeing you and hearing more from you. So if you need anything else, we are more than welcome to answer your questions or provide any support that you can. Just please feel free to reach out to anybody at the healthywilliamsoncounty.org, and we will see you soon.